We know that time is key in terms of treating the brain and promoting good recovery. If someone comes in right away, within 30 minutes, an hour, and they've just had stroke symptoms, the treatment is different because we're trying to restore blood flow to the brain in a very limited time. Versus someone who comes in several days after they've had a stroke, that treatment is going to be different because the brain has already been injured. The FDA-approved treatment for acute ischemic stroke is TPA, tissue plasminogen activator. It essentially is a blood thinner to restore the blood flow that has been reduced to the brain, causing the stroke. And that time, or the time that we can give it, is within 3 hours of symptom onset. Sometimes we can extend the time period to 4.5 hours. That's for very select patients, but really it is within 3 to 4.5 hours for IV TPA. There's some situations where we can't give people TPA, and that is determined by a lot of different factors. If they're on very strong blood thinners already, if they've had a recent head injury, if they've had recent surgery, if they have problems with their blood where they don't clot well. So what's interesting is there's been a new game changer in stroke. In addition to giving a very strong blood thinner, many times we can actually go into the blood vessels of the brain and pull the clot out. It sounds like science fiction, but it actually is true and very effective. An angiogram is done, and an angiogram means that we're mapping out the blood vessels. So a small catheter is placed in the groin artery, and under x-rays we're able to see all the blood vessels in the body. The catheter goes into the blood vessel that is occluded or narrowed and tries to take the clot out of the blood vessel through the catheter and then pull it out of the body. So it really is phenomenal. What we found out in recent trials is that with some people who have very large strokes or coming in with a lot of symptoms, that if we get them in right away and we're able to take the clot out of the artery, that they can have minimal or no deficits. The time period for endovascular therapy could be 6 hours after symptom onset, might be even longer, but it really depends on the person, and the longer you wait, the more likely that that is not appropriate. So really coming in right away is key because doctors are going to be able to determine which treatment you're eligible for.